Ted in Rhode Island says, I was recently referred by my primary care doctor to a new medical specialist due to the retirement of my current one. I had my yearly checkup in early May with the new specialist and was charged my $50 copay, given a clean bill of health and a follow-up in a year. A week later, I received a bill for $379.81 from this physician, charging for hospital-based services. Upon investigation, the new specialist office in the same office park location as my prior specialist, and not anywhere near the hospital, is designated as a hospital-based location. They claim to be a satellite affiliated with the local hospital and can charge facilities fee for checkup appointments. I was never advised of the fee, nor was this location considered a hospital. I've contacted Rhode Island's Lifespan Health System and was advised I have no recourse but to pay, and any future checkups with the specialist would include this hospital-based services fee. I also contacted the Rhode Island Attorney General's office, and though I have not yet heard back. Is this essentially a new revenue stream for healthcare? And is there any additional action that you would advise?
So, Ted, it's actually worse than all that. What's happening is in markets all over the country, hospitals are bulking up and becoming hospital systems. They're buying up primary care practices, specialist practices, and the rest to act as a feeder. I got an email from my insurer just yesterday saying, you know, that test you just had, if you click here, we'll show you how much money you would have saved if you had not had it at a hospital-affiliated facility. And I would have saved $271 of it out of my own pocket. Wow. If I had not had it at the hospital-based facility. And the hospitals buy up these practices. The doctors become employees. They pay the doctors usually, in many cases, in the millions of dollars to sell their practices. And then the patients are billed for this through these junk fees. So the doctors become employees, no longer own their own practice. The hospital has paid all this money and has to pay the doctor a salary, and they turn around and bill you these junk fees. And these are, as stated, it's exactly as you said, they're satellite facilities, i.e. doctors' offices or nondescript doctors' building or medical building somewhere. But for insurance purposes, they're all treated as if they're in the building of the hospital itself that sent the junk fee. So anytime you are hiring a doctor, think of it this way, you are the patient hiring a doctor. You are the customer going to that doctor. The question you need to ask now is this doctor employed by a hospital system, or are they an independent doctor? Because otherwise, you're going to see all these fees a lot of times not covered by insurance.